My name is Beata Jagirska. I am director of National Cancer Institute in Poland. Really, we observed that about 1,700 maybe will pass of the cancer per year, of course. Ahead of us, the great challenge, because we would like to implement cancer plan, Polish cancer plan. It means national oncological strategy. The last time it's April 2025. Up to this data, we would like implement the national oncological network. So it's really the challenge for us. The National Oncological Network, it means cooperation between different kinds of references centers, not only oncological centers, but all units which realize oncological treatment, oncological diagnostic. It's difficult to say. We have complex structure of healthcare system. So the great challenge is to connect everything. It means not only hospital, not only oncological hospital, but different ambulatories, and change our mind about cooperation. So cooperation, it means that we work together for our patients.
I'm Mark van den Bulke. I'm the head of the Cancer Center at Cienzano, and Cienzano is the National Institute for Health of Belgium. Can Heal is a project within the EU for Health, European Beating Cancer Plan initiative of the Commission that aims at bridging between prevention, diagnosis and treatment. And to foster these initiatives, we decided to go on the one hand a little bit bottom up by having a number of use cases that could support us in finding what ways we could make this bridge. And on the other hand, we set up a framework that evaluates where the different use cases are in a process to be implemented. And we have decided to have two arms. One is on public health genomics, and one is on diagnosis and treatment. And we have now, we're at the stage that the first evaluations have been made. We have another year. So we can now start thinking on completing that. And then the aim of Can Heal is to make some recommendations for further actions in the upcoming 4, 5, 6 years of the EBCP. We have representatives of 17 member states, and we have hospitals, we have universities, we have public health institutes, we have, let's say, supportive agencies, and we also have some member states and patient organizations. I think the direct let's say opportunities for Can Heal are a number of upcoming joint actions. There is a joint action on digital tools that definitely could fit with one of the ambitions of Can Heal, is setting up a molecular tumor board and supporting an international molecular tumor board where digital could be important. And then there is after the summer the opening of the joint action personalized medicine, where we think that it would be interesting to have an arm that is, let's say, tackling the hospital, the diagnosis and treatment, but also going back to the population in more prevention, and maybe also look forward towards supportive survivorship precision survivorship, which is something new.
My name is Salvatore Provenzano and I'm a medical oncologist working at the Fondazione IRCCS, Istituto Nazionale dei Tumori in Milan, Italy. JANE is a joint action co-founded by the European Commission with the objective of building at least seven network of expertise which will tackle transversal condition important for cancer patients in Europe. I think they can really be friends because tackling transversal conditions in cancer in Europe means also facing equity of access to care, to services. So since this is one of the main objectives of the joint action JANE, we can definitely cooperate. At the moment, JANE is focusing on shaping this network of expertise. We already are setting its future, which will be called JANE 2, in which we will start the activities we are planning with the concurrent joint action. So we will start the activities during a second joint action, which will last 4 years, and then we will see what's happening after those 4 years.
My name is Roberto Grasso. I'm a psycho-oncologist, psychotherapist working at the European Institute of Oncologists in the lab of Prof.ssa Gabriella Pravettoni. Because it's a EU4Health project, this is aiming to mapping capacity and capabilities in an OECI comprehensive cancer center and try to reduce cancer disparities across Europe. The Beacon project will end in 5 months, and we are trying to get collaboration with other EU4Health project funded and to move forward after the end of the project and try to exploit our decision support system for the 4 stakeholders. The 4 stakeholders are patient, of course, primary, but also clinician, researcher, and policymaker. The biggest challenge with Beacon is try to get feedback from the OECI Cancer Center to get accuracy of the information that we collect so far. Beacon is an opportunity for Europe to reduce the cancer disparities, mainly in psycho-oncological support, which is an area that is not covered in all the 27 member states.
Hello, I'm Tom Di Maio. I am Head of Diagnostic for Europe and Canada at AstraZeneca. Equity access for me is making sure that every patient could have the best cancer care. I think that making sure that regardless where you're coming from, your zip code, your age, your gender, you have the best possible care. I think there was many challenges, but there is one which really stands up, which is making sure that there is funding for cancer care, regardless where you are coming from. It's been funding across the board, meaning funding for testing, for diagnosis, for early screening, and most naturally for treatment. I think that in a lot of countries, there is currently tension between the money that you allocate for healthcare, the money that you allocate for other challenges like climate change, defense, and so on. I think in the end, in many different countries, this is a collective choice. It's a choice that has got to be made through election by choosing how you are allocating your taxpayer money. I think one of the main drivers is really stating the common goal, which is making sure that every patient got the best possible care. I think there are some very interesting public campaigns regarding early cancer screening, making sure that if you are at risk, you get screened, because it will dramatically improve your chance of cure.
I'm Alini, and I'm a data scientist at SparData. So the wiki is the place where we're storing all the metadata we are collecting through Beacon. The decision support tool will use the data we're collecting, the data from the wiki, and present it in a more user-friendly way to patients, to our stakeholders. Patients, providers, researchers, and policymakers. Data is important to allow us to make better decisions, so it can help our stakeholders, patients, providers, policymakers, and researchers into finding what they need and making decisions. The biggest challenges we have right now is there is data, but it's not easy to access. Through the Beacon project, we noticed that even metadata, which is what we're gathering, is hard to access. Sometimes the information is scattered. There's no easily accessible data dictionaries and so on. So there are multiple challenges that we face. So if it is difficult to access metadata, accessing the actual data is even more difficult. The Beacon project can contribute as being a solution, but the Beacon project is just the start. We should think of other options. One thing that we have been starting to think would be great if we could have a repository where we could, a GDPR compliant repository where we could store the data to make it more easy to access.
I'm Paweł Sobczuk, medical oncologist, European Young Oncologist Group member, and ESMO Young Oncologist Committee member. The biggest challenge right now is the shortage of healthcare workers in oncology, and also the need to stay on pace of the fast changes in oncology that's growing very fast. The issue with burnout is huge. It's around 70% of oncologists worldwide are burnout, and it affects both young oncologists and those who are much longer in the field. Definitely it has impact, because if we are burnout, our communication with patients is less effective, and it might affect their treatment also. First, we need a good plan to take care of workforce, how to recruit, retain those who are already in the field, and make people return and be able to work as oncologists and in the field of oncology, because this applies also to nurses and other healthcare professionals. And the second is to provide mental support and some administrative support to reduce the workload and the bureaucracy that quite often in many countries rely on oncologists.
My name is Tito Albrecht. I work as the project coordinator at the National Institute of Public Health of Slovenia. Joint Action Crane is a project that was set up to prepare the framework and the set of standards for the establishment of the European network of comprehensive cancer centers. The next steps are to finalize the work, which will take place in the next couple of months. And immediately after the end of Joint Action Crane, a new joint action, a much bigger one, will be launched, which will effectively set up the EU network of CCCs and also pilot some of the solutions which are required for specific situations in EU member states. This is the main challenge of the project, namely what are the benefits for patients. From our point of view, the most important benefits are in improving quality and enhancing the translation of research findings into clinical practice, which can be ensured in settings that actually combine research, care, and education and training.
My name is Javier Carmona, and I'm currently Chief Scientific Officer of Cancer Core Europe and Head of Scientific Strategy at Valdebrona Institute of Oncology in Barcelona. So Cancer Core Europe is an alliance of leading cancer centers in Europe who was created 10 years ago with the goal of bringing translational research closer to clinical care, but also leverage the collaboration and expertise and resources of all these 7 centers towards a common goal. In order to bring Cancer Core Europe as an example of collaboration, we seek to explore the synergies between the different centers and also build bridges with the different European initiatives that are now being created within the cancer mission, so that we can accelerate that transition between research and clinical implementation. Cancer Core Europe has brought benefit to the patients by accelerating that transition from translational research innovations into early phase clinical care of patients, also with partnerships not only with academia but also with the private sector, which is a critical stakeholder in this venture.
Hi, so my name is Hugo Soares and I'm the coordinator of the European project ECOS, which stands for Establishing National Cancer Mission Hubs and the creation of synergies and networks on cancer. ECOS is a flagship project from the Cancer Mission, and the idea behind it is to create these new structures that are the National Cancer Mission Hubs. Basically, deconstructing this is these are hubs connecting the Cancer Mission to member states. So they operate, or they should operate, at the national level and bridge what is the European Commission perspective on cancer, developing screening involving patients, involving more of the community outside research and innovation, outside the healthcare, so go beyond what are the common frameworks and involve and create the culture, let's say, against cancer throughout Europe. Sure. So our direct, let's say, activities are not directly to patient itself. So I believe that in the daily life, patients will not see ECOS that much, but what we are is a supporting structure. It's like a platform, a central platform serving the community and centralizing and do all these support activities that are sometimes cumbersome for those that should be focusing, let's say, in healthcare are not doing these other side activities.
I'm Rossana Alessandrello. I'm from Aquas. Aquas is the agency of health technology assessment of Catalonia, and I'm the value-based procurement director. We are leading the work package 3, that is the evaluation work package. We are 3 entities, Aquas together with NKI, the Netherlands Cancer Institute, and with Fisabio. And all together we are putting together a framework on how to evaluate innovative interventions that are going to take place in public health and also in the clinical world to ensure that this, at the end, these innovative interventions can be implemented, adopted and scaled up, taking into consideration the impact that they are going to generate and also the equity aspects. The comprehensive cancer center are a key basement in this field, and the way to improve their capacity is to ensure that we understand the needs from strategic point of view that needs to be addressed in a way that then from there we start the basing and basements, and from there we build all the policy strategies and also the healthcare strategies that need to take place. Definitions are important because each of us has a different understanding of the words. And if you don't have a common definition, you don't have then a common plan how to take, to address the specific issues. So if, for instance, when we are talking about needs, sometimes people take in consideration just clinical needs, but needs are maybe needs that are taking place in the healthcare delivery, not just in the clinical needs. So we need always to understand when we put a word needs, what we're talking about. Results, maybe are clinical outcomes, maybe are results that are affecting the patient journey, maybe are results that are affecting the healthcare professionals. So again, the word results needs to be really well defined depending on the context we are talking about. So the definition every time needs to be addressed in a comprehensive way, taking into consideration all the stakeholders that are working together in a specific initiative, projects, intervention, so we have the same view, a common view.
My name is Dennis Horgan. I'm the Executive Director of the European Alliance for Personalised Medicine. Beacon wants to tackle the disparities in cancer care, but we need a framework to tackle this so that there's a common understanding and a common purpose and a common way how to achieve this. And there's different regulatory frameworks. The European Beating Cancer Plan is a policy framework, but then you have regulatory frameworks such as European Health Data Space, the Clinical Trials Regulation, the General Data Protection Regulation, and then you have broader policy frameworks such as the Pharmaceutical Strategy. And all these pieces of legislation are intended to improve access to patients or improve frameworks so that diagnostics and treatment and delivery of care can be reached to the patient. So it's very important in how we develop Beacon that the policy frameworks and the legislative frameworks can support Beacon in empowering the comprehensive cancer centers and cancer centers in delivering the best care for the patient.
I'm Frederick Novak and I'm the coordinator of the French Genomic Medicine Initiative. Genomic Medicine Initiative was implemented in 2016 in order to provide whole genome sequencing for rare disease patients and cancer patients. It is, for example, with a French genomic medicine initiative, because for rare diseases it provides a better diagnosis for all patients, because often it is an odyssey to have a diagnosis for rare disease. And for cancer, it's to have a better treatment and a molecular guided treatment. France, in France, it was supporting by the successive national cancer plan and national rare disease plan. So it was very key to structure the organizational framework in the country. And then it is very important to interact at the European level in order to not reinvent the wheel, to share best practices, to get best practices. Because if we have an operational initiative, nevertheless, we have many challenges to tackle. It's far from being perfect, and we have many challenges. We have to keep the political support of the French Ministry of Health, French Ministry of Research, for sure. And we have to have the commitment of all stakeholders in France, more in particular for data sharing, because it is still something to get operational in France. So it is a key point in order to have success and to be successful on the long term.
I'm Dar Monani. I'm an assistant professor in general psychology at the University of Palermo, working in the Beacon project. In Beacon, we are taking care of the identification of disparities, barriers, and obstacles. So we conduct qualitative interview and also focus group discussion with all the stakeholders to try to identify their unmet needs. And specifically, we target disparities, obstacles, and barriers related to psychological assessment and psychological support for cancer patients and caregivers. Yeah, probably the results of the focus group discussion with patients said that they are struggling in finding information regarding the availability of psychological support in oncological center. There are also some cultural beliefs and stigma that can also obstacle and hinder the access to the psychological support. There are also some disparity related to socio-demographic variables. So, for example, elderly people, but also male patients, but also people living in rural area can have strong difficulties in having access to psychological support.
My name is Yasmina Koeva, and I'm the chair of the board of the Bulgarian Alliance for Precision and Personalized Medicine. Unfortunately, not yet, but it's getting more and more supporters. For example, 10 years ago, when I started to work on personalized medicine, it was perceived as something exotic and boutique, meant only for rich countries. Nowadays, there is actually no big medical event that there is at least one session dedicated to personalized medicine. Well, this is a difficult question, and I would say that we have some improvements, but we have a lot of challenges. The improvement is that finally last year we have adopted a national cancer plan, and also good is that especially for development of this plan was created a Bulgarian Oncological Alliance that unites more than 25 organizations involved in cancer care. There are other improvements as well, like, for example, increasing of the budget dedicated to cancer treatment, the budget of National Insurance Health Fund. And also, a good thing is that the technological equipment of the cancer centers is definitely above the EU average. And of course, we have some challenges, and one of the biggest challenge is that diagnostics of cancer in Bulgaria is quite late, and this is due to lack of national screening programs for the most common types of cancer. But it's already planned, and it's set up in the national cancer plan, and the funding is already ensured by the government. Definitely I am. Good thing is that there is, in fact, a collaboration between state-owned and private cancer centers. In fact, it is a national cancer network, joint national cancer network, which comprises of 20 state-owned and 6 private cancer centers. It is not centralized, but anyway, there is a good collaboration between them.